Coming up, we'll be on location at Happy Smiles Dental in Clarksburg, Maryland, discussing the latest advances in dentistry and how they can help restore your teeth, improve your oral health, and give you that beautiful smile you've always desired with one of this region's top dentists, Dr. Alireza Hamidzadeh. Welcome, Dr. Hamidzadeh, to the Top Doctors Interviews program.
Thank you so much for having me.
Oh, it's our pleasure. We've got a lot to talk about. There's been so many advances in dentistry that can help patients. But before we get into that, I wanted to touch on your practice and your background. You're recognized as a top dentist throughout the Maryland region. You've helped so many patients improve their oral health, help them get beautiful smiles, actually improve their confidence and change their lives. I wanted to begin by asking you about your vision for your practice.
As you mentioned, Nick, the science in medicine, including dentistry as being part of the medicine, has changed significantly. And it is changing. Every day we come across more advances towards making things better and easier, more accessible. And that's the vision. We are walking towards that vision very firmly by implementing the latest technology in our practice to provide our patients with same-day treatments and also all treatments in the same day, which we believe brings tremendous value, especially to the busy people with busy lives of any walk of life. They could be the CEO or a parent. It doesn't matter. We know that lives are getting busier, and the most valuable commodity that most people don't have is time. So we are geared to give our patients same day, whatever that needs or they desires done, and say they come here one visit and they get finished and they go home.
That's great, and I know that the patients love you. We spoke to some of your patients and they rave about how much you really care. Your patient care is impeccable, and really in this day and age that goes a long way, because many people have these experiences where they go to other practices, and I won't name any names, but there's so many experiences that are just another number. They sit and wait for a long time. They only see the doctor for a minute. But in this practice, you take the time with each patient because you understand each patient's different. You customize the treatment and solution for each patient. And I really love that approach. Thank you for offering that in this community.
It is an absolute pleasure, and in my view, and our obligation to our patients. Basically, as a part of our ethical and legal obligation to provide our patients with an informed consent, and then the emphasis there is informed. So we have to be able to communicate what the concerns are and what are the consequences, and then offer remedies. And the patients has to engage and understand, and not just sign something and just get on their way to pay an amount and get something done. So our philosophy is that even though we are doctors of the mouth, our priority is the person who is attached to the mouth. So we have to see the person first and then look inside the needs and the desires related to their oral cavity and teeth.
That's a great approach, Dr. H. Now, there's been so many different treatments out there that are helping patients improve their oral health and their smiles. Can you tell us about some of the most effective treatments that you offer here at your practice?
Absolutely. To begin with, I'd like to underline the fact that one of our strengths is that we offer a variety of different treatments based on patients' needs and desires again. So we are not like a one-size-fits-all office. We have many tools in our toolbox, so we will find out which tool best matches the patient as opposed to match the patient forcefully to our tools. Having said that, there is no job that is too small or too big for us. We have performed many advanced surgeries where a patient comes here and they spend time like 4 to 8 hours, and they just, in one day, their smiles are completely transformed. People out there might have heard of like same-day teeth. The treatment is known by different names, but they all refer to the same type of treatment when at a point and a juncture, the best treatment a patient can get is just a brand new smile, and we are very good at delivering that.
And who's a good candidate for that treatment or those treatments? Are these dental implants that you're speaking of, doctor?
Absolutely. They are the basis of this treatment is the dental implants. A great candidate for this treatment is either a patient who does not have enough teeth, or they have teeth with multiple different problems. They're, as in to fix different single teeth is going to be a lot more cumbersome medically and financially, with basically lower chances of longevity and success. It is truly age independent. So a person can have this procedure done in their 20s and 30s. A person can have this procedure done in their 70s. Or even 80s, depending on their health. So there is no true age inhibition. We do care about basically, again, finding what is going to be the best treatment for our patient without getting ourselves into a tunnel vision of like making something that is not going to fit in there just because we wanted to.
So it's really customized, as you mentioned, for each patient because everybody's different. Some people may be having a certain type of gum or bone structure that may be a candidate or may not, so you have to customize it for each patient.
Absolutely, like their underlying medical conditions, their social habits. I mean, implants are generally speaking a great treatment and we are excellent at delivering them. But having said that, they may not be the best treatment for some. So we have that flexibility then to offer alternatives. Our biggest strength, Nick, it is truly our versatility and different kinds of abilities where we are the one-stop shop where the patient comes and we can do their routine cleaning all the way to the most advanced dental and oral surgeries.
That's great because this way it's a huge benefit for patients because you don't have to refer them out to other specialists. You can pretty much do everything here. That means you really know that patient, they feel comfortable with you, and patients don't know what their experience will be like with someone else. So the fact that you can do everything here is a huge benefit.
If we wouldn't be boasting, I believe so too, because I myself as a patient who has to work a lot, I have a family to raise, I often find myself the most pressing thing for me is the time to go see my doctors for my needs, for my medical needs. And then being referred to different doctors for different things, and that just becomes a very taxing issue on the time and the quality of life, and even with compliance, because the more you have to go to these appointments, less likely you are to actually comply. If you have to go one appointment on one corner of the basically the DMV area and one appointment in the other corner of it. But I always thought that things should be easier and more accessible. So accessibility is something that we do really well and we offer our patients.
And you have the training and the specialization in each of these areas, and that's why you're providing great results for your patients.
I am, by training, a U.S. Army trained comprehensive dentist. That means that in the U.S. military, there is a specialty called comprehensive care, and basically in dental medicine. And that specialty trains you to be proficient at different disciplines of dentistry, basically pretty much from A to Z. And that's what my background is. I've also had the fortune and the honor to be an adjunct professor at Walter Reed National Medical Center, which is the basically the flagship medical center of the whole country.
Well, I want to thank you for serving the country. That's great.
Absolute pleasure.
And now you're serving the patients in the community as well by improving their oral health.
Absolute pleasure. It's truly a pleasure of mine.
And what other treatments do you focus on here, doctor, that you want to talk to about in the community?
One thing that perhaps is, again, more unique about us is that not only we offer the entire array of different treatments in different disciplines of oral medicine and dentistry, we offer them under IV sedation, true sedation. A lot of times there is basically a confusion about what sedation means. Now, sometimes patients and people may come across sedations by laughing gas or a pill, and that is truly called anxiolysis. That's something that can relax, but it is not really a sedation. We do offer IV sedation, which is a true form of sedation. And for that, you have to, again, have certain trainings and have to pass certain credentials to be licensed for it. So not only we can sedate our patients for surgical procedures, we can sedate our patients for non-surgical procedures. So, for example, if a person comes and they are just too anxious to get a filling, a root canal, a crown, these typical routine dental treatments, they can benefit from one of the best ways to basically be completely in a state of tranquil and have a twilight sleep, so to speak, while the treatment is being rendered. So not only we could do sedations, for example, for taking out wisdom teeth and doing these complex surgeries, sinus lifts, etc. We can also sedate patients to their root canals, to do their dental fittings, to even do their cleanings. We have had patients who have had many traumatic experiences in the past, and they wanted to be sedated to just get a cleaning done. So we believe, again, that adds a lot to our accessibility. Patients with special needs may be a category where we can be very helpful, that they may not be able to endure any type of regular treatments under normal settings. So again, high anxiety patients or complex procedures, we are here to help them make them most comfortable, and many times we are able to give them all their treatment or most of their treatment while they're under sedation in the same day.
That's great to know that you actually offer IV sedation, because we see these dentists and other practices saying we offer sedation dentistry, but it's not true sedation. It's some kind of pill or something that helps them relax, but IV sedation is true sedation. And as far as dental anxiety goes, so many people experience dental anxiety from, as you mentioned, traumatic experiences from their childhood, going to a dentist, some pain or something they experience. So having that option is great to know.
We believe in it too. We really want people to overcome the fear, and going to any kind of doctor, Nick, takes courage. I mean, nobody likes to have problems, especially when it's concerning their health. So one of the inhibiting factors to seek proper care, again, is our fears and our anxieties, and dentistry has been well known for that, and we really geared to help based on the most current science and technology that is available today to hopefully bring care to those who haven't been seeking care because of this fear.
So dental implants can definitely improve our oral health, and some of these treatments all under sedation is, like I said, it makes it much easier for the patient. You also offer cosmetic dentistry, Dr. H. Can you tell us more about it?
Yeah, absolutely. We actually, myself and some of our doctors are highly trained in doing cosmetic dentistry, basically giving patients the smile that they deserve and desire. We are often misunderstood that teeth are just for chewing. That is not true. In fact, the most important function of the top front teeth is first aesthetic, second is phonetics, pronouncing things, and then the third function is chewing. So looking good, it is not a need. Everybody wants to look good. It makes us socialize better. It gives a boost to our confidence. We live happier, and those are extremely valuable. So we understand and appreciate the importance of that. And whatever we do, from implant dentistry to veneers to other kinds of modality of treatments, we always make our patients aware of their smile, and we listen to them as to what their thoughts are, if they're happy or if they're not happy, or if they want things changed. And basically we give them the possibility of change, and if then they like to go through with it, we will provide that change to the highest standards of care.
That's a great point, Dr. H. Our confidence is associated with our smile, because when we have a really nice smile, we smile more. And it's scientifically known that when we smile, there's chemical endorphins and things that are released that actually improve our health. And that confidence improves our workplace success, our career paths, our family life, because we're feeling better about ourselves. And it really is a key point to know that that aesthetic smile can really change our lives as well.
Absolutely. I couldn't have said it better.
What kind of results have your patients been getting, Dr. H, from some of these treatments?
I am proud to inform you, Nick, that our success rate is very high. Be it implants or veneers, Invisalign, regardless of modality of treatment, we have a very high success rate. The patients getting great results, and as noted by our Google reviews, it has been a great pleasure to help so many patients and families, so many people in the community. And when I say community, Nick, I just don't mean like our immediate vicinities. Though we are located in Maryland, we get many patients from DC, from Virginia, from West Virginia, from Pennsylvania. We have patients from Canada. We have patients from California. So we are fortunate to have been an instrument of help to our community nearby and basically throughout the continent of North America.
Well, keep doing the great work, Dr. H. Like I said, your practice here, Happy Smiles, truly makes your patients very happy. So it's a great name for your practice. And I want to thank you so much for educating us, informing us, and being a guest on our program.
It's been a pleasure, Nick.